Good morning, everybody. The next topic we're going to be going over is what we call the athlete's hierarchy of needs. This is a flow chart that we are going to be walking through and that you can walk through later on to try to figure out why you're getting pain, where your limitations lie, and how to fix those. We put together skills that we think everyone needs to have in order to be effective, and then we're going to walk you through it now. On the bottom of the pyramid, we have flexibility. This is perhaps the most important part of movement because flexibility is your passive range of motion. So this is how much range of motion your joint has with the help of the outside world. So it's usually going to be your maximum range of motion. This is how flexible my finger is. You can see that I'm pushing it back, so my finger is this flexible. All too often, flexibility and mobility kind of get clumped in together as the same terms when they're really two very distinct issues. One's passive range of motion, which is flexibility. One's your mobility, which is your active range of motion. So it's no longer how far can I push your finger back, but it's how far can I raise it. So these are two different things. If you don't have proper flexibility, you're not going to have proper mobility because it's just not possible. So if we take a look at my knee, if my knee is only this flexible, and then I try to squat, my squat's going to look like this. I just can't get past. Whereas your proper range of motion is going to be the whole way down and the whole way back up. If you don't have proper flexibility or proper mobility, and you're trying to get your squat to look better, you're going to end up spending a lot of time squatting like this, trying to get down, 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 and it's just not going to work because you don't have that range of motion available to you to use. So if you have been trying the squat therapy, you've been trying everything else to try to get into a better squat position, and haven't yet looked at your knee range of motion, flexibility, and mobility, well then that's an inherent issue because if you don't have those two movements working well, well then you aren't going to be able to squat. So flexibility is your passive range of motion, something that we always check first to make sure that is full. If that is full, we then check your active range of motion. So just because I can get your joint in a certain position, can you get it there in a controlled manner? Those are two very distinct issues, but also two important topics as far as movement is concerned. Now, if you have been having some pain, having some tightness, having some issues getting into either a squat or a good snatch position, and you've spent a lot of time doing foam rollers, doing lacrosse balls, and doing voodoo floss, as good as those things are at working through your momentary tight tissues, they don't provide a long-term result or a long-term resource. So this is where our programming is going to come in. We're going to be able to help you with the long-term issues, not just rolling a foam roller for a little bit, rolling a lacrosse ball for a little bit, and then feel better for the next hour, but then comes back the next day. And we're going to give you some ideas and some methods to make those changes last a little bit longer. With that being said as well, if you're having pain, and you have full range of motion, full flexibility, full mobility, and you're spending all your time doing lacrosse ball work and foam roller work, you're not going to see any results because that's not where your problem is. Lacrosse balls and foam rollers are great at trying to increase mobility and flexibility, but if you already have full range of motion, you're basically wasting your time. You need to find something else to do because that's not going to solve your pain or help your problems at all. So if you have full flexibility and full mobility, the next topic we're going to be talking about is your strength balance. So who here knows their back squat within 5 or 10 pounds? Who here knows how much of that weight you're pushing with your right leg versus your left leg? Isn't that something you should know? If you're dropping into a squat with 400 pounds, shouldn't you know if your right leg's pushing 200 or 300 and your left leg's pushing 200 or 100? Well, if your right leg's pushing 300, your left leg's pushing 100, what's that going to do to your joints and your back and your motion? It's going to basically make that motion not very efficient. It's going to cause you pain. It's going to cause you tightness. So strength balance is a really big issue that not many people are spending enough time dealing with. They're too busy doing some mobility work when their range of motion's fine. If your range of motion's fine, you got to figure out what's going on. Are you imbalanced, left and right? Are you imbalanced up and down? Is your upper body more pronounced than your lower body? Well, that's going to affect your cleans, your snatches, especially your deadlifts as well. So these are issues that we're going to be dealing with, and we're going to be taking the next couple hours to figure out how flexible you are, how mobile you are, and then we're also going to be looking at how well you are as far as strength balance goes. These are things we need to figure out in order to get you out of pain and to get you on the right track. Now, for those athletes where they have full flexibility, they have full mobility, and their strength balance is perfect, then they should be out of pain. If they still have pain, well, then we need to go to the top of, or the next movement up. So here is work to recovery. So is the athlete taking enough time to recover from their given workouts? It's a pretty simple question to ask. You can ask any athlete. So when's the last time you took a recovery day? When's the last time you took a rest day? When's the last time you took a full rest day? Typically with the last question, I get looked at kind of funny. Athletes just don't take full rest days. They think that a recovery day involves a 5K row and a light swim. So there's a good, better, and best principle here. Ideally, you would like to be spending as much time on your recovery as you are working out. Most people find it impossible due to just time constraints. So a good way to do it is if you're going to be spending an hour or two at the gym, we want you to spend at least 20 minutes on recovery. Now, this doesn't mean just sitting there watching TV. It means active recovery, whether it's going for a slow walk, slow jog, maybe you're using a Compex machine, maybe getting a massage, and then start building on that. Best would be a 1-to-1 ratio. If you're working out for an hour and a half, you got to recover for an hour and a half. Whether it's a float tank, a massage, you're doing something for recovery. Typically, athletes don't think they have enough time, and they spend too much time in the gym and not enough time recovering. Also in this recovery category falls into the sleep. So how much sleep are you getting and how much stress are you under? So we've seen a lot of athletes who have great flexibility, great mobility, great strength balance, but they're still in pain. So we work our way up the triangle, and then we ultimately find out that they're working 13 hours a day, sleeping for 4 hours a night, training for 3 hours, and eating like garbage. Well, you're not providing your body with a chance to recover. Your nutrition is all out of whack, you're eating garbage, you're not sleeping well enough, and you're not taking any recovery into account. So those are the things that are going to set you up for failure. If your mobility is good, flexibility is good, so if you move well, your strength balance is spot on, well, now you got to start looking at how well are you recovering. Are you making a conscious effort to recover after each workout? If not, start doing it. On the very top of the pyramid, we have skill. So this is the smallest part of the triangle, but it's also the one that could take the most time. This is where your coaches come into play. If you move really well, you're balanced really well, you're sleeping, you're eating well, you're resting well, you're recovering well, and you have pain, well, it's probably because your technique's garbage. This is the person we see at the competitions where they're snatching, they kind of catch it here and they press it out. Well, if that happens, you should just drop the barbell. Find your nearest coach and spend some time working on how to get yourself better at that technique. There's a lot of skill movements in the CrossFit world and in the lifting world that take a long time to build upon. Well, that's where your coaches. You guys have great coaches. Go find them, set up an appointment, and learn how to do the technique better. Don't try to jump to a higher skill movement when you don't have the basics or the foundations mastered yet. You're going to set yourself up for injuries, and you're going to ultimately be the one sitting on the side modifying everything because you can't do the workout because you're now injured. Now, if we take this triangle and we cut it in half, we like to think that we're really good at treating everything to the right of this triangle. We are really good at helping you with your flexibility, your mobility, so we're great at helping you move well. We're great at helping you find out whether or not you're balanced as far as strength goes. We can help you a little bit with the work to recovery. We can give you some ideas, but if we don't follow you around, it's hard to really make sure that you adhere to our guidelines. And as far as skill goes, we could give you some ideas. We know how to do the movements, but we're not the best for it. That's what your coaches are for. They're in charge of perfecting your skill. Hopefully they're in charge of nagging you on the work to recovery aspect of life as well. And then we get to take care of your movements and your strength balance. If you think back to the previous chart that we had in the previous graph, those 3 boxes, you'll see how the soft tissue injuries fall down to the mobility and flexibility. You'll see how the stress diet and sleep falls onto the work recovery. So we can use these 2 charts interchangeably to also work on your work capacity. So just a quick overview. This is the flow chart we use when somebody comes in. Do they move well? Are they balanced well? Do they have the proper work to recovery? And what is their skill level? This is what you're going to do over the next several hours. You're going to find out how well you move, how well you are at being balanced, and then you're going to take that information and you're going to know what's wrong with you and how to fix it. This is profound. As opposed to just guessing if it's going to be foam roller, lacrosse ball, should I voodoo floss, should I work out more? You're going to know. You're going to know what your ankles do. You're going to know what your knee does, what your shoulder does. Does it move well? Is there a sticking point? How do I fix it? If all those are great, well then you're going to find out where you're imbalanced. Should I do more high pulls? Should I do more deadlifts? At what weight? At what reps? You're going to walk out with a functional diagnosis knowing what is wrong. You're going to take that information and then use it to make yourself better, get you pain-free, get you injury-free, so that you can then work out harder, pain-free, and raise your work capacity and get to where everybody wants to be. They want to work out harder, work out smarter, and work out pain-free. Does anyone have any questions?